Hello. Hi, good evening, Mr. Chakravarti. How are you? Thank you for joining early. I think your active participation motivates us and our entire team. Thank you so much for being a part of each and every session before time. And that is something which is great and helps all of us to feel that this information is really helpful for all of you who are a part of today's session. Hello, Mr. Ajay Kumar. Good evening. How are you? Meanwhile, I would love to know how was the yoga session yesterday? Have you all shared the feedback with your coaches? If not, please share it today. If you want to share the feedback directly with me, don't forget to drop in the chat box right now. How was the yoga webinar for yesterday? Hello, Mr. Terkhedkar. Good evening. How are you? Thank you so much for coming back. I hope you liked the yoga session yesterday and it was quite helpful for you. Do share your feedback in the chat box with me now or with your health coaches over the app. Let's wait for few of our AccuCheck Wealthy family members and then we'll start with today's discussion. Hello Shambulal ji, कैसे हैं आप? I hope you are taking enough care of your health. कल का योगा सेशन कैसा लगा आपको? फीडबैक जरूर शेयर कीजिए अपने कोच के साथ and we'll be happy to help you more because we are coming up with a series of sessions of mindfulness, yoga, doctor understanding, clinical basics, application study, outcome specific discussion. All of these things will be done over this entire year as a part of webinars. So let's ensure all of us give timely feedbacks on the sessions we attend. Hello Harshal ji, good evening. How are you? Thank you for joining today's session. Hello Sanjeev ji, good evening. I hope you attended the yoga session yesterday. Do share the feedback with all of us. We will be happy for any kind of suggestions you have. Hello Pramod ji, good evening. Meeting you after a long time through these sessions. Hope you are doing well. Hello Vinod ji, good evening. How are you? Hello Suchitra ji, कैसे हैं आप? All right. Thank you so much for being a part of today's session. We still have 2 to 3 minutes more to start with today's discussion. And then we'll start with our special guest, as you see on your screen today. Every week, as promised, we are bringing the AccuCheck Wealthy family with a lot of new information, new speakers, and ensuring that all of us not just work on our health, our blood sugars, our weight management, our heart health, our overall lifestyle, but we also get educated. We also share the knowledge not just within our circle, but as many people as we can help with. All right. Um, Thank you so much. I was about to ask this question. If any one of you can just update us in the chat box, what is today's session about and who's our special speaker for today? If you all must have seen the graphic, the information which was sent to you by your coaches, you will know who's today's speaker and what is the session about. We are very happy with many of you who are a part of today's session to know that exactly what kind of session you look forward to, what kind of information do you want from us. We will be happy to know. Feel free to share the feedback with us or my team. All right. Without any further wait, let's introduce our special guest for today. I'm sure you must have met Dr. Sneha Damse before this in few of our sessions. But just to introduce to few of our new members who are a part of today's session, Dr. Sneha Damse is a clinical expert, a general practitioner by profession who has helped more than 5,000 users on a worldwide level. She is the person who is responsible for creating the amazing app information, the app journeys, the small videos, audios, quiz lessons which you read in the program. So very innovative ways are actually taken care of while giving the information out to all of our users, and Dr. Sneha is a part of that team. With um collective effort, we have this amazing application journey for all of our users, specific to ensuring you learn more, you work on your lifestyle, and you work on your behavior. With this, Dr. Sneha is a certified medical professional with an experience of 10 plus years in this industry, with a patient database of 5,000 plus users. We are absolutely happy to have you as a part of our ongoing sessions, Dr. Sneha. And thank you so much for spending your weekend with us. Welcome to AccuCheck Wellthy, and over to you, Sneha.
Thank you, Rutuja. Thank you for the introduction, and good evening, everyone. It's nice to see some of the familiar names again joining our session today. So as some of you have already pointed out, today's session is about home exercises. In diabetes, what are the different exercises that you can do at home? आप घर में कैसे fit रह सकते हैं? इसका आपको क्या क्या बेनिफिट्स मिलेगा, और कितना इम्पोर्टेंट है एक्सरसाइज करना घर पे, ये सब हम आज के सेशन में डिस्कस करेंगे. तो जस्ट मुझे एक सेकेंड दीजिए, मैं अपनी स्क्रीन शेयर कर दूंगी. Rutuja, let me know if you're able to see my screen properly.
Yes, visible. Just click on slideshow.
Okay, let's start off with our today's session. So home exercise techniques in diabetes, like the name mentions, what are the different exercises that you can do while you're at home? What are the benefits that you will receive from doing such small exercises at home? ऐसी सब छोटी मोटी एक्सरसाइज करने के लिए आपको कोई जिम ज्वाइन करने की जरूरत नहीं है, आपको कोई फैंसी इक्विपमेंट खरीदने की जरूरत नहीं है. आप घर बैठे बैठे, या तो फिर आप कभी घर के बाहर कोई छोटा मोटा काम करने जा रहे हो, तब भी ये छोटी छोटी एक्सरसाइजेस कर सकते हो. आप देख पाओगे पूरे सेशन में कि 30 मिनट 20 मिनट की एक्सरसाइजेस, आप कभी जब किसी मार्केट में जा रहे हो, आप सीढ़ियां चढ़ रहे हो, ऐसी छोटी मोटी एक्सरसाइजेस का भी आपकी हेल्थ पे कितना बेनिफिट हो सकता है, वो हम इस सेशन में आज हाईलाइट करेंगे. तो आपको ऑलरेडी पता होगा, आपके हेल्थ कोचेस हमेशा आपसे डिस्कस करते होंगे कि फूड और एक्सरसाइज का कितना बड़ा इंपॉर्टेंस है आपकी डायबिटीज मैनेजमेंट में. सिर्फ 30 मिनट्स की एक्सरसाइज भी अगर आप रोज परफॉर्म करो, या तो फिर एक दिन छोड़ के भी परफॉर्म करो, तो इससे ना ही जो लोग जिनको डायबिटीज नहीं है उनका डायबिटीज डेवलप होने का रिस्क कम होता है, बट ऑलरेडी जिन लोगों को डायबिटीज डेवलप हो चुका है उनके चांसेस ऑफ डेवलपिंग कोई भी कॉम्प्लिकेशन, डायबिटीज का जो भी कोई कॉम्प्लिकेशन होता है, कोई हार्ट डिजीज होती है, कोई किडनी डिजीज वगैरह होती है, उसका रिस्क भी आप काफी कम कर सकते हैं अगर सिर्फ आप दिन में 30 मिनट किसी एक्सरसाइज, छोटी एक्सरसाइज को दे पाए तो लेट्स सी कि एक्चुअली जो आप एक्सरसाइजेस परफॉर्म करते हैं वो आपकी डायबिटीज पे एक्चुअली क्या इम्पैक्ट पड़ता है, या आपके इंसुलिन लेवल्स या आपके ब्लड ग्लूकोज लेवल्स को कैसे अफेक्ट करता है. तो अगर आपको ये समझ में आ जाए कि 30 मिनट की एक्सरसाइज में भी अगर आपका ब्लड ग्लूकोज इतना कम हो सकता है या इतना मैनेज हो सकता है, तो सोचिए अगर आप ये रेगुलरली करते जाए, इफ द एक्सरसाइज इज डन रेगुलरली एवरी वीक, देन हाउ मच कैन इट इम्पैक्ट योर डायबिटीज इन द लॉन्ग टर्म. तो हाउ डज द एक्सरसाइज एक्चुअली हेल्प इन डायबिटीज? हमने काफी बारी सुना है लोगों से कि नॉट जस्ट आपका कैलोरीज वगैरह चेक करो, आपकी कार्बोहाइड्रेट इनटेक चेक करो, बट ऑल्सो कि आप हमेशा एक्टिव रहे, आप फिट रहे। इसका भी कोई कारण होता है। हमारे हेल्थ कोचेस या तो फिर जो डॉक्टर्स है, फिजियोथेरेपिस्ट है बाहर, वो ऐसे ही नहीं कहते कि आपको एक्सरसाइज करना चाहिए रोज। देर आर सर्टेन रीजंस बिहाइंड व्हाई दिस इज usually recommended to the patients, and this is one of the major important factors that can not just manage your diabetes, but also in the long term it can has the impact of maybe reducing maybe reversing your diabetes. तो आपका blood glucose हमेशा आपके normal levels में रहेगा, ये भी हो सकता है। तो let's see what does exercise actually do in a diabetic patient. तो आप ऑलरेडी जानते हो कि एक डायबिटिक पेशेंट में जो इंसुलिन का सेंसिटिविटी होता है, जैसे जब भी कोई आपकी बॉडी में टिश्यूज होते हैं, आपकी बॉडी में जो सेल्स होते हैं, वो टिश्यूज और सेल्स रिस्पॉन्ड नहीं कर पाते बराबर से इंसुलिन को। आपकी बॉडी जनरेट कर रही है इंसुलिन, बट देन आपके सेल्स उसको बराबर से रिस्पॉन्ड नहीं कर रहे हैं। तो एक्सरसाइज करते हुए क्या होता है कि आपके जो मसल्स, आपके मसल्स के जो सेल्स होते हैं वो एक्टिव हो जाते हैं, आपके मसल्स कॉन्ट्रैक्ट करते हैं, वो एक्टिव रहते हैं। तो उस समय पर ये मसल के जो सेल्स होते हैं वो इंसुलिन की दे बिकम मोर सेंसिटिव टू द इंसुलिन दैट इज रिलीज्ड बाय योर बॉडी. So now that they have become more sensitive to the insulin, they are able to take up the glucose that is generated, the glucose that is present in your blood during the exercise as well as after the exercise. So एक्सरसाइज का एक मेजर इम्पैक्ट होता है कि आपके सेल्स, आपके बॉडी में जो सेल्स है वो थोड़े और सेंसिटिव हो जाते हैं इंसुलिन को, और वो हेल्प करते हैं आपकी सेल्स को ग्लूकोज इनटेक लेने में। एंड इसकी वजह से जो आपके ब्लड में ग्लूकोज का लेवल है वो कम हो सकता है या नॉर्मलाइज हो सकता है। दैट इज वन ऑफ द मेजर इम्पॉर्टेंट फैक्टर्स ऑफ one of the major important factors that is impacting your blood glucose levels while doing exercises. दूसरा और तरीका जो भी एक्सरसाइज के टाइम पे होता है कि जैसे मैंने कहा कि जब आप वर्कआउट करते हैं, आप कोई भी एक्सरसाइज करते हैं, आपके मसल्स कॉन्ट्रैक्ट होते हैं उसके टाइम पे। और जब भी कोई भी आप कोई भी एक्सरसाइज परफॉर्म कर रहे हो तो आपकी बॉडी को एनर्जी चाहिए होती है। ये एनर्जी बॉडी को यूजुअली ग्लूकोज से मिलती है। तो जब आप एक्सरसाइज कर रहे हो, जो ग्लूकोज आपकी बॉडी में प्रेजेंट है, अगर वहां पे इंसुलिन हो ना हो, उसके बावजूद आपकी बॉडी और अपटेक करने लगती है ग्लूकोज को। योर बॉडी टेक्स अप दिस ग्लूकोज मोर इजिली with or without the help of insulin. So that is one of the major important factors as well. Another impact, obviously, that how does exercise help in diabetes is we all know that overweight या obesity जो होती है, कुछ लोगों का वजन कुछ ज्यादा हो जाता है, इसका ज्यादा इम्पैक्ट पड़ता है डायबिटीज में। उसकी वजह से ज्यादा कॉम्प्लिकेशंस होते हैं डायबिटीज में। तो एक्सरसाइज करते समय ऑब्वियसली इट विल हेल्प यू मेंटेन अ हेल्दी वेट इफ यू आर ओवरवेट। अगर आप ओबीज हो तो आपका वेट नॉर्मल रेंज में आ सकता है, आपका रिस्क हार्ट डिजीज का या तो फिर कोई और भी कॉम्प्लिकेशंस का काफी कम हो जाता है। और जैसे मैंने ऑलरेडी कह दिया है कि रिड्यूसेस योर रिस्क ऑफ डेवलपिंग एनी काइंड ऑफ हार्ट डिजीजेस। नाउ जब हम एक्सरसाइज की बात कर रहे हैं और ये जैसे ब्लड ग्लूकोज को कम करता है, इसका इम्पैक्ट यूजुअली जो होता है वो लॉन्ग टर्म नहीं होता। तो आप समझो आपने आज एक्सरसाइज की, 30 मिनट की एक्सरसाइज परफॉर्म की, तो अगले 24 घंटे तक वो जो ब्लड ग्लूकोज लोअरिंग इफेक्ट होता है उस एक्सरसाइज का, वो 24 घंटे तक रहेगा। बट अगर आप रेगुलरली एक्सरसाइज कर रहे हो, मे बी दिन, मतलब एक हफ्ते में अगर आप 5 दिन परफॉर्म कर रहे हो, टाइम पे परफॉर्म कर रहे हो, तो फिर लॉन्ग टर्म में भी आपका HbA1c इम्पैक्ट कर सकता है। तो ऐसा मत सोचिए कि अगर मैंने एक दिन एक्सरसाइज की तो इसका कोई लॉन्ग टर्म इम्पैक्ट नहीं रहेगा। अगर आप रेगुलरली आपके स्केड्यूल पे स्टिक करते हो, अगर आप प्रॉपर एक्सरसाइजेस परफॉर्म करते हो आपके डॉक्टर के कंसल्टेशन के हिसाब से, आपके फिजियोथेरेपिस्ट के कंसल्टेशन के हिसाब से, तो लॉन्ग टर्म में भी आपका ब्लड ग्लूकोज एज वेल एज HbA1c कम हो सकता है. एंड दैट इज व्हाई वी से दैट exercise and lifestyle modifications like such as diet can have impact on reversing your diabetes, so you can get back to leading a normal life. Now, what are the different benefits of exercise? This also, I think, a lot of our patients or a lot of our users might have already heard of or might know of. So, maintaining a healthy weight, that is a very obvious thing, that if you exercise more, you will maintain a healthier weight. You will be able to get into the normal weight range, or even if you are a little bit obese or you're a little bit overweight, you'll still be able to maintain a healthier and a more active lifestyle. फीलिंग हैप्पियर, ऑब्वियसली आपने अगर ये कहीं पढ़ा होगा तो देखा होगा कि जब आप एक्सरसाइज करते हो तो आपकी बॉडी में एक हार्मोन जनरेट होता है कॉल्ड एज एंडोर्फिन्स. Endorphins are called as the happy hormone. Every time you exercise, you release this hormone, and this hormone has the impact of making you feel more happier. तो इस हार्मोन की वजह से आपको फील होता है कि आपने कुछ अचीव किया है, आपको और खुशी महसूस होती है. तो फिर इसीलिए काफी बारी बोला जाता है कि एक्सरसाइज करने के बाद आपको काफी एस्टैब्लिश्ड फील होता है, या तो आपको बहुत ही अच्छा लगता है. तो ये उस हार्मोन की वजह से होता है. When you're also exercising on a regular basis, it will help you regularize your sleeping cycle. It will help you sleep better. When your body is exerting, जब आपकी body exercise perform कर रही है, आप थोड़ा obviously थक जाते हो. उस थकावट की वजह से आप अच्छे से सो भी पाते हो. And then in the long term, अगर आप इस exercise schedule से और या इस exercise pattern से फेमिलियराइज हो जाते हो या फिर रेगुलरली परफॉर्म करने लगते हो, तो आप नेचुरली आपकी बॉडी प्रॉपर स्लीपिंग पैटर्न्स फॉलो करना चालू कर देती है. तो फिर इट ऑब्वियसली एक्सरसाइज, दैट इज व्हाई हेल्प्स यू स्लीप अ लॉट मोर बेटर. Improving memory, if you're sleeping better, if you're maintaining a healthy lifestyle, if you're active, then all of this sort of ultimately contributes to having increased focus whenever you're working in the morning during your work hours, and that is how it sort of impacts your memory as well. Maintaining your BP and cholesterol, this is a very obvious thing. If you are actively following exercise patterns or exercise schedules, then आपके बॉडी में जो बैड कोलेस्ट्रॉल होता है उसका लेवल्स भी काफी कम हो जाता है, आपका बीपी भी नॉर्मल पे आ जाता है, बिकॉज इट इज नॉट because you're burning off all of the bad cholesterol, you're burning off all of the bad calories, then उसकी वजह से आपकी बॉडी पे उतना exertion नहीं आ रहा, आपके blood vessels पे उतना exertion नहीं आ रहा है, and that is why, that is how it helps in maintaining your blood pressure as well. Now, whenever I say that you need to stay active, या तो आपको exercises perform करनी है, ऐसा नहीं है कि मैं आपको कह रही हूँ कि आप रोज जिम जाए या तो फिर वहां पे एक्सटेंसिव कार्डियो करे या तो फिर वेट लिफ्टिंग करे, बॉडी बिल्डिंग करे. वो सब दैट इज नॉट नेसेसरी फॉर यू टू मेंटेन अ एक्टिव लाइफस्टाइल और यू टू बी फिजिकली फिट. The exercises that you perform can be moderate intensity. Now, what exactly is moderate intensity is कि आपको पता है कि जब आप एक्सरसाइज परफॉर्म करते हो आपकी हार्ट रेट बढ़ जाती है, थोड़ा पसीना छूट जाता है, तो इतना भी काफी होता है कि अगर आप समझो कोई भी एक्सरसाइज परफॉर्म कर रहे हो, अगर आपकी हार्ट रेट थोड़ी भी रेज होती है या तो आपको थोड़ा भी पसीना छूट जाता है, इसका मतलब कि आपकी बॉडी एक्सर्ट कर रही है, आपकी बॉडी एक्टिव हो रही है, आपके मसल्स कॉन्ट्रैक्ट हो रहे हैं. तो दैट इज द डेफिनेशन ऑफ मॉडरेट इंटेंसिटी फिजिकल एक्टिविटी. And you don't need to perform this activity for a long duration. The goal is to perform 150 minutes of exercise throughout the week or per week. You can break it down into different schedule patterns as you would like, or as it fits your schedule. You can try to fit at least 20 to 25 minutes of activity every day. or you can perform 50 minutes of exercise 3 times a week, whatever fits you best. If you don't have a lot of time to perform these exercises, then you can do it 3 times a week for 50 minutes, or if you have some time in the evening or sometime in the morning, however it works for you, you can perform it for 20 to 25 minutes every day as well. Additionally, also it is important that 2 or more days a week, हफ्ते में अगर 2 बार से 2 या उससे थोड़ा ज्यादा, अगर आप सारे मसल्स ग्रुप जो है उसको भी एक्टिव रखे, तो मसल ग्रुप्स एज इन लेग्स के मसल पे भी काम करे, हिप्स के मसल्स पे भी काम करे, बैक मसल्स, एब्डोमेन मसल्स, तो ट्राई टू इंक्लूड ऑल ऑफ दीज मसल्स in your weekly activity, so that your entire body stays fit and active and it does not cause any further problems to you. It is also important to keep in mind कि जो भी exercises आपके doctors या आपके physiotherapists आपको recommend करते हैं, आप उसको सही से आपके डॉक्टर से या फिजियोथेरेपिस्ट से कंसल्ट करके जान लेके उसको परफॉर्म करना कैसे है, क्योंकि कभी कभी ऐसा भी हो सकता है कि आपने एक्सरसाइज डॉक्टर से ले तो ली, आपने कहीं यूट्यूब पे देख तो ली, बट देन अगर आप उसको सही से परफॉर्म नहीं करते हो तो फिर वो आपके मसल्स को और डैमेजिंग हो सकता है, या तो फिर इट कैन एंड अप डैमेजिंग योर बॉडी इवन मोर if you're not performing it correctly. So keep in mind that whichever exercise you decide to take up, whichever exercise you decide is comfortable for you, you do it properly in the right method or in the right way so as to not damage your muscles. Now there are, like I've previously mentioned, you can consult your doctor. Your doctor can give you the exercises that can be performed, or your doctor can refer you to a physiotherapist. A physiotherapist is someone who looks after maintaining the physical activities or in maintaining the physical well-being of a patient's body, how to get it to be more fit, what are the correct exercises for different muscles, what are the correct exercises for different health conditions. A physiotherapist will know this the best, obviously. So you can choose to go to a physiotherapist who can help you with this, but we can also recommend certain small exercises which it does not require a lot of expertise, but it will still have a good impact on your diabetes and your health conditions. Like I said, a physical therapist can help you perform safe and they can recommend to you safe and effective exercise programs. An exercise program is nothing but different types of exercises that will be given to you to perform for a certain duration of time throughout the week. When can it be performed? How can it be performed? What are the different benefits of those exercises? This exercise program will consist of all of that. Ultimately, the goal of any exercise that you perform is not just to stay fit, but also to lower your blood sugar levels, your HbA1c level. And a physical therapist, if you have any kind of disability because of your diabetes condition, these exercises will also help you improve the ability. अगर आपको चलने में दिक्कत हो रही है, आपके पैर में अल्सर वगैरह है, तो उसकी वजह से अगर आपको चलना फिरना थोड़ा मुश्किल लग रहा है, तो ये जो एक्सरसाइजेस फिजिकल थेरेपिस्ट रेकमेंड करेंगे वो आपकी दिस विल हेल्प यू इम्प्रूव द एबिलिटी टू मूव. ये आपको चलने फिरने में और इजी बना सकती है ये एक्सरसाइजेस. एंड जो पेन, जो दर्द आपके अल्सर से एसोसिएटेड है, वो भी काफी कम हो सकता है. So there are there's a different spectrum of benefits for all of the patients that they can get out of it. Whenever जब भी कोई फिजिकल थेरेपिस्ट या डॉक्टर आपको कुछ भी प्रिस्क्राइब कर रहा हो या कुछ भी रेकमेंड कर रहा हो, तो उसके पहले ऑब्वियसली वो थोड़े बहुत टेस्ट परफॉर्म करेंगे, थोड़े बहुत असेसमेंट्स करेंगे कि आपको एक्चुअली जरूरत किस चीज की है. आपको अगर आपके मसल्स में स्ट्रेंथ क्रिएट करना है, फ्लेक्सिबिलिटी क्रिएट करनी है, बैलेंस लाना है, या तो फिर आपको सिर्फ पेन पे काम करना है, ये सारी असेसमेंट्स फिजिकल थेरेपिस्ट आपको एक्सरसाइज प्रोग्राम देने से पहले परफॉर्म करेंगे. एंड देन अकॉर्डिंगली जो आपके लिए बेस्ट हो वो आपको रेकमेंड किया जाएगा. नाउ हमने काफी बेनिफिट्स के बारे में बात कर ली कि क्या हो सकता है उसका इम्पैक्ट आपके ब्लड ग्लूकोज लेवल्स पे या तो आपके HbA1c लेवल्स पे, आपके रिस्क पे. We've talked about how much you need to perform these exercises and why is it important to go to a physical therapist if required in order to perform those exercises or get an exercise schedules. But aside from, all of these big exercise schedules or these exercise programs, there are some very common exercises, very easy to perform. You can do this at your home easily without any fancy equipment. That is what I'm going to try to talk to you about, and even show you a short video that will walk you through all of these exercises, and you will see how easy it is to perform these exercises. तो जैसे मैंने बोला था पहले कि यू डोंट नीड टू परफॉर्म एनी जिम में जाके आपको बॉडी बिल्डिंग नहीं करनी, वेट लिफ्टिंग नहीं करना, आपको लो टू मॉडरेट इंटेंसिटी एक्सरसाइजेस परफॉर्म करनी है, जिसके वजह से आपका हार्ट रेट बढ़े और आपको थोड़ा सा स्वेटिंग, आपको थोड़ा सा पसीना छूटे, मतलब एक्सरसाइज करने का थोड़ा बहुत तो फायदा दिखे आपको वहां से भी. तो इसमें जैसे मैंने कहा काफी सिंपल एक्सरसाइजेस होती है, आपको कुछ ज्यादा करने की जरूरत नहीं है. Some of the examples that I can give you of moderate या low intensity exercises: walking briskly. Now, what does walking briskly exactly mean? आप नॉर्मली जब वॉक करते हो, आप धीरे धीरे वॉक करते हो. अ ब्रिस्क वॉक इज थोड़ा सा पेस उसमें ऐड करे, थोड़ा सा स्पीड उसमें ऐड करे, तो देन दैट बिकम्स वॉकिंग ब्रिस्कली. यू कैन डू दिस फॉर 30 minutes or 50 minutes depending upon whatever is best for you. Even doing housework such as vacuuming or gardening can be considered as a moderate intensity exercise because your whole body is moving when you're doing these things. आप जब छत को वैक्यूम कर रहे हो, आप फ्लोर को वैक्यूम कर रहे हो, आप यहाँ वहाँ कॉर्नर्स में जाके जब सफाई करते हो, तो उसकी वजह से भी आपके जो मसल्स है वो काफी वर्कअप हो जाता है, वो काफी कॉन्ट्रैक्ट हो जाता है. तो रेगुलर एक्टिविटीज सच एज डूइंग हाउसवर्क कैन ऑल्सो काउंट एज मॉडरेट इंटेंसिटी एक्सरसाइजेस. स्विमिंग, अगर आपको स्विमिंग का शौक है तो स्विमिंग इज अ ग्रेट एक्सरसाइज दैट विल वर्क ऑन योर एंटायर बॉडी, ऑन ऑल ऑफ योर मसल ग्रुप्स and not just one specific muscle. Your legs, your arms, your abdomen, your back, everything is getting worked in swimming. तो अगर आपको swimming पसंद है या तो आप swimming करना जानते हो, तो try to do a few laps in 20 minutes, as many laps as you can in 20 minutes. And this will not just build your endurance, but आपके muscles का flexibility and strength भी काफी बढ़ेगा. आपको अगर डांसिंग का शौक है तो डांसिंग ऑल्सो काउंट्स एज अ मॉडरेट इंटेंसिटी एक्सरसाइज. दिस डज नॉट हैव टू बी, डांसिंग का मतलब ये नहीं है कि आप स्पेसिफिक स्टेप्स फॉलो करो या तो फिर ऐसे ही होना चाहिए, आपको जैसे मन करता है. आप, द इम्पोर्टेंट थिंग इज दैट यू मूव योर बॉडी. So dancing, you can do it anyhow you want. You don't need to worry about what it looks like. You just need to move your body. You just need to get active. So dancing is a very is a pretty good moderate intensity exercise, and it is also a little bit more fun than the other exercises like doing housework or walking or swimming. So dancing, definitely, if you're fond of it, you can take this up as an exercise. Yoga is also another important thing, because if you do it correctly, if you work the right muscle groups, then this has a great impact on your health. We usually do have a lot of yoga sessions for you guys. I hope that these yoga sessions are something that you're implementing in your day-to-day life and are able to perform all of the exercises that are recommended by the yoga instructors. If you do have any questions on those, let us know. We'll be happy to answer them. Now, whenever you're performing any kind of exercise, आप जब भी कोई exercise perform कर रहे हो, ऐसा ना सोचे कि बस आपने exercise शुरू कर दी और छोड़ दिया and then it will impact your body. कुछ कुछ चीजें होती है एक्सरसाइज करते समय भी जो आपको ध्यान में रखनी पड़ती है. आप एक्सरसाइज शुरू करने से पहले एक छोटा वार्म अप जरूर करें. द इम्पोर्टेंस ऑफ अ वार्म अप इज दैट कि आपके मसल्स जो काफी टाइम से इनएक्टिव है या तो फिर रेस्ट फेज में है, वो थोड़े वार्म अप हो जाते हैं, वो थोड़े एक्टिव हो जाते हैं, सो दैट you can actively start working or start doing a certain exercise. So it is important to warm up before you start working on the core exercises. And after you have finished completing the exercise, आपकी exercising जब खत्म हो जाती है, आप वॉक से वापस आ जाते हैं या तो आप स्विमिंग से वापस आ जाता है, तो फिर एक कूल डाउन एक्सरसाइज करना भी इम्पोर्टेंट होता है. A cool down exercise, what does a cool down exercise exactly do is कि जैसे these are opposite things, a warm up and a cool down. इनिशियली आप ट्राई कर रहे हो कि आप अपने मसल्स को एक्टिव करें ताकि आप एक्सरसाइज परफॉर्म कर सको, और एक्सरसाइज कंप्लीट होने के बाद नाउ यू आर ट्राइंग टू गेट योर मसल्स टू गेट टू अ रेस्टिंग फेज सो दैट दे डोंट हर्ट और they don't get damaged. So there are certain exercises that will help you cool down those muscles. So try not to skip both of these phases before you start performing an exercise. A cool down is obviously also important in reducing the heart rate post your workout, and a warm up does the opposite thing. It helps you in increasing that heart rate. Again, a few more things that you do need to keep in mind before you start exercising. या तो जब भी आप कोई एक्सरसाइज प्रोग्राम स्टार्ट करने वाले हो, उससे पहले ये ध्यान में रखिए कि आप वही सारी एक्सरसाइजेस परफॉर्म करिए जो आपको पसंद हो, ताकि इट विल बी इजियर, आपके लिए वो इजी हो जाएगा कि आप उसको रेगुलर बेसिस पे फॉलो करें. अगर आपने आपकी एक्सरसाइज शेड्यूल में या तो आपकी एक्सरसाइज प्रोग्राम में ऐसी कोई एक्सरसाइज ऐड की हो जो आपको बिल्कुल पसंद नहीं है या तो आपको मुश्किल लग रही है करने में, तो चांसेस है कि आप उसको रेगुलरली फॉलो नहीं करेंगे, या तो आप बोर हो जाएंगे या तो आप बहुत ही ज्यादा थक जाएंगे, आपके मसल्स अडेप्ट नहीं हो पाएंगे उस एक्सरसाइज को. तो ये इम्पोर्टेंट है कि आप अपने स्केड्यूल में वही सारी एक्सरसाइजेज ऐड करें जो आपको करने में भी मजा आता हो और आपके लिए इजी भी हो, सो दैट इट बिकम्स easier for you to follow it on a long term basis. Initially, whenever you're starting off with any exercise, be it swimming, या cycling, या तो walking briskly, going for a jog, जो भी एक्सरसाइज हो, आप ये याद रखिए कि आप अपने आप को बहुत ही ज्यादा एक्सर्ट ना करें. ऐसा ना हो जाए कि आप एक्सरसाइज करने निकले हो, अब किसी जॉग पे जा रहे हो तो आप 2 घंटे जॉगिंग कर रहे हो, 2 घंटे चल रहे हो. This puts unnecessary stress on your body. So it is important that you start small. आप थोड़े थोड़े मिनट्स उसमें ऐड कर सकते हैं. आप 15 मिनट से स्टार्ट कर सकते हैं, आप 20 मिनट से स्टार्ट कर सकते हैं, एंड देन वंस यू बिकम कंफर्टेबल, अगर आप कंफर्टेबल हो 20 मिनट से, तो उसमें आप और 10 मिनट ऐड कर सकते हो. देन यू कैन वॉक फॉर 10 more minutes. So usually over time try to build upon those try to build upon the intensity of exercise that you're performing, so that your body is also getting used to it on a day-to-day basis and not suddenly. Because if you're suddenly doing this, समझो मैंने आज एक्सरसाइज करना चालू कर दिया एंड मैंने सडनली 1 घंटे वर्कआउट कर लिया, so obviously next day my body will be very tired and then I won't be able to do exercise for the next 2 or 3 days. So in order to avoid such a situation where your body is not extremely exerted, start small and then build up on that. Obviously you can't just start working out and not have a specific goal. It is important to stick to a goal. You can talk to your doctor about what your specific goal is. आपके डॉक्टर आपकी हेल्थ कंडीशन को सबसे बेस्ट जानते हैं. उस हेल्थ कंडीशन के हिसाब से आपके और कोई अगर आपको बीमारियां हो ना हो, उसके हिसाब से आपके डॉक्टर आपको बता सकते हैं कि आपको कितने मिनट्स एक्सरसाइज करना है, आपको हफ्ते में कितनी बार एक्सरसाइज करना है. तो ये जो गोल सेटिंग होता है एक्सरसाइज का, वो आपके डॉक्टर उसमें जरूर हेल्प कर सकते हैं. इफ नॉट, आप आपके लिए खुद का एक छोटा इजी गोल भी रख सकते हैं, विच यू कैन बिल्ड अपॉन ओवर टाइम. Schedule, very important that you perform it regularly at a specific time. If you're performing it in the morning, do it in the morning. If you're performing it in the evening, then do it every day in the evening as well, so that there is no fluctuation or any difference in the amount of time your body is getting to recover from the previous day's exercise. समझो अगर आपने कल शाम को एक्सरसाइज की है एंड देन आज आपने वापस सुबह को एक्सरसाइज कर दी, तो आपकी बॉडी को उतना एडजस्टमेंट का टाइम नहीं मिलता. तो ट्राई टू स्टिक टू अ टाइम. डोंट लेट इट फ्लक्चुएट अ लॉट, so that it's easier on your body, and your body is also getting used to it. Now, there are certain special things that you also need to keep in mind is before you start any physical activity, obviously check with your doctors, because कभी कभी ऐसे हो सकता है कि ऐसा ना हो कि हम आपको एक्सरसाइज करने कह रहे हैं, बट अगर आपको कोई दूसरी बीमारी हो जो आपको रिस्ट्रिक्ट कर रही हो, या तो फिर कोई दूसरी बीमारी जिसकी वजह से आप बराबर से एक्सरसाइज नहीं कर पाओगे, तो इट विल डैमेज यू इवन मोर. So talk to your doctor before you start any kind of physical activity. They'll be the best to guide you through this. They'll be the best judge of what best suits you as well. Drink plenty of fluids while being physically active to prevent any dehydration. Obviously, this is a very obvious thing that a lot of people keep on forgetting. That sometimes when people start working out, they forget to drink fluids, या तो फिर काफी कम fluids पी लेते हैं. इसकी वजह से ड्यूरिंग एक्सरसाइज, एज वी नो, वी आर स्वेटिंग अ लॉट, हमको काफी पसीना आता है, जिसकी वजह से बहुत सारा लॉस ऑफ वाटर हो जाता है. आपकी बॉडी काफी वाटर लूज कर रही है ऐसे टाइम पे. सो इट इज इम्पोर्टेंट दैट यू कीप योर बॉडी हाइड्रेटेड थ्रू आउट द ड्यूरेशन ऑफ एक्सरसाइजिंग. इफ नेसेसरी टेक ब्रेक्स इन बिटवीन. ऐसा नहीं है कि आपने आपके लिए 30 मिनट्स का गोल सेटअप किया है तो आप कंटिन्यूअसली 30 मिनट्स वर्कआउट करते रहे. आपको अगर 10 मिनट बाद लगता है कि आपसे हो नहीं पा रहा, तो आप 1-2 मिनट का ब्रेक ले लीजिए एंड देन यू कंटिन्यू अगेन. So try not to exert your body is the important point over here. Before you start working out, before you start exercising, during exercising, and even after exercising, keep a check on your blood glucose levels. Check करे कि आपका blood glucose level range में है, normal range में है, जो आपके लिए recommend किया गया है. If it is very low, if it is lower than 100 milligram per deciliter, तो थोड़ा कार्बोहाइड्रेट intake कीजिएगा. ये जो आपके हेल्थ कोचेस आपको यूजुअली कहते हैं कि 15 to 20 grams of carbohydrates to increase your blood sugar, and then after 15 minutes you check it again. If it's come back to the normal level, then you start working out. Because ऐसा ना हो जाए कि आपका blood glucose level already काफी कम है एंड देन आपने एक्सरसाइज स्टार्ट कर दी तो उसकी वजह से और कम हो सकता है, और उसकी वजह से आपको हाइपोग्लाइसीमिया हो सकता है. तो ट्राई टू अवॉइड दो सिचुएशन. Keep your blood glucose meters with you. Check it before exercise. Even during exercise, if you feel like you're not feeling well, check it again. See if it's gone below 100 milligram per deciliter या काफी कम हो गया है. And even after exercising, see how low it has gotten. If it gets too low और आपको लग रहा है कि आप hypoglycemia के पास हो, तो try to increase your carb intake by taking 15 to 20 grams of carbohydrates to increase your blood sugar level or to get it back to normal. So try to keep these in mind. Sometimes it can also happen that heavy exercises such as weightlifting or doing cardio, like high intensity cardio, can have the opposite impact of lowering. These exercises can sometimes increase your blood sugar levels. These are the exercises such as, like I mentioned, bodybuilding, weightlifting, high intensity exercises, because what the body does during these high intensity exercises is that it releases a hormone called as adrenaline. adrenaline will work on your, or will have an impact on your liver, and your liver will then generate more sugar, so blood sugar. So that is why sometimes high intensity workouts or high intensity exercises will increase your blood sugar level. So try not to do these high intensity level exercises before recommending, before talking to your doctor about them, so that they can prescribe what is best for you. डायबिटीज में काफी कंडीशंस होती है, काफी कॉम्प्लिकेशंस होती है, ये हम भी जानते हैं. उसमें से सबसे कॉमन कॉम्प्लिकेशन जो होती है वो होती है डायबिटिक फुट या डायबिटिक अल्सर्स. तो जब भी आप कोई वर्कआउट कर रहे हो, आप स्पोर्ट शूज पहनते हो, आप जब वॉक पे जाते हो, यू टेंड टू पुट ऑन स्पोर्ट शूज. नाउ make sure that whenever you're trying to exercise or you're putting on these shoes, they're fitting you well. आप उसमें कंफर्टेबल हो, ऐसा नहीं है कि आपको कोई शू बाइट हो रहा है. Try to wear cotton socks so that your feet are able to breathe in them, and the sweat is not just getting causing any more issues to your ulcers or to your diabetic foot. So while you're trying to be physically active, also try to keep these things in mind. Try to check your blood sugar levels after you finished working out, obviously. And once you have finished your exercise, आपकी सारी exercises perform करके हो गई, whether it's swimming, whether it's walking, cycling, walking the stairs, जो भी आप exercise perform कर रहे हो, आप जब ये complete करके वापस आओ तो check करें कि आपकी पैर पे कोई कट्स, ब्लिस्टर्स, कोई सोर, कोई नई इंजरी डेवलप नहीं हुई है, आपके पैर को कोई और एडिशनल ट्रॉमा नहीं हुआ है. क्योंकि ये जो छोटे मोटे कट्स होते हैं, ये जो छोटी मोटी इंजरीज होती है, वो आगे जाके अल्सर्स डेवलप कर सकती है, या तो फिर ये आगे जाके अल्सर्स बन सकती है. तो आप जो भी एक्सरसाइज परफॉर्म कर रहे हो, आप इन चीजों का जरूर चेक रखें. Now coming to a few exercises that, simple exercises that anyone can perform at home. We have a short video that we'd like to play for you. These are not, like I mentioned previously, जैसे मैंने पहले कहा था कि इसके लिए आपको कोई इक्विपमेंट लाने की जरूरत नहीं है, इसके लिए आपको जिम जाने की जरूरत नहीं है. आप घर बैठे बैठे, आपके पास जब भी फ्री टाइम हो, 30 मिनट हो, आप ये परफॉर्म कर सकते हैं. इससे आपकी फ्लेक्सिबिलिटी बढ़ेगी, इससे आपके मसल्स का स्ट्रेंथ बढ़ेगा. तो लेट्स जस्ट हैव अ क्विक लुक एट दीज एक्सरसाइजेस. Rutuja, do let me know if you guys are able to see the video properly. I can make those adjustments if required.
Sure.
So your diabetes exercises for seniors at home routine. Fun routine. And always check with your doctor or healthcare team for readiness or any exercise program. When you're ready to get started, I want you to meet me in a march. We've got 10 seconds to march together before we start with our first exercise, which is a step touch with an arm jack. Are you ready? We're going to step side to side and reach the arms open and close. All of the exercises that we'll be doing in this fitness video will improve your mobility, your strength, and done consistently will help you improve your health and get your diabetes under control. So I want you to commit to meeting me on a daily basis for a little bit of movement medicine. 10 minutes is all it takes to improve your health. And if you have more time, use it. I've got a lot of fitness videos for you to play with. So keep moving the body side to side as you open and close those arms in a big jumping jack. 50 seconds. Feel free to take breaks whenever you need it. And don't forget to breathe. Nice job. I'm so proud of you for being here today. I know you're going to be successful. Stretch. Bring your hands to your chest and push back and step together. Here we go. Press and step. So you practice this at-home routine. You'll get better at all the moves and soon be able to trim with greater fitness. It's all about practicing consistently. You will get better with practice. Push forward and stretch those calves. Remember, as we age, it's so important to maintain our mobility so that we can be for whatever life hands us next. Have the energy to play with our family. Stand up nice and tall, keep pushing those arms forward, and when you hear the bell, we're gonna march. You've got about 5 seconds left. Good. Stay with me, and let's march. Nice job. So, exercise number 3 is a jump rope. We're going to take our arms out to the side and make big circles. From here, I want you to bring one knee up and switch. Now remember, coordination is also a really good thing to practice. It helps improve your mental fitness. So even if you feel uncoordinated or some of the moves make your brain work a little bit hard, it's a good thing. We want to increase not just our physical health, but our mental health as well through exercise. So remember, there's no such thing as messing up. As long as you show up, you're doing it right. Keep that big circle going with the arms. Increase the range of motion with every breath. Good job. Awesome. Stay with it. Once we hear the bell, we'll march it out together. You are doing great. All right, next move. We're going to reach up towards the sky and towards the chest. All right, this will help work our balance. We go knee, switch. If you'd like to linger for a second, as long as you're breathing and you're smiling, you're doing it right. I exercise not just great mobility. So we bring our legs together, going to tap out and center, tap and center. Feel free to go slower or faster. I'm just Michael.
Guys, I'll just show you how the exercises are done because we're a little short on time. We'll show you how each exercise is performed, but we won't go through the entire video.
Changes with commitment and consistency. Even if it gets hard, don't give up. Bend over the side and up. Alternate sides. You don't have to bend the legs that much. Bend as much as feels comfortable to you today. Squeeze your bottom and your hips forward at the top. Good. Breathe. I bet if you did this video routine as many days as possible throughout your week, you would feel a significant improvement in your energy and you would see your blood sugar start to normalize. That would be awesome. And you would go see your doctor and they...
Oh, sorry, guys.
And that would feel so good. Open and close, open and close, open and close. If you have friends that would also benefit from this video routine, share the video with them. The more the merrier. You can even invite them over to do some exercise with you. 10 minutes goes a long way. I would love to hear from you in the comments below if you feel and see good work and march it out. Next is an exercise to stretch the inner thighs and strengthen the legs. We'll take the legs wide, toes forward, heels back, and you're going to sit the butt back, bring it up, and back, bring it up. Do the best you can. It doesn't matter if it looks right, it just matters about how you feel. Good, so sit the hips back, find that stretch in the inner thigh, the adductor. This adductor is in the front of our thighs and strengthen the back. With a butt kick, you're going to bring your heel to your butt. Ready? Go. Heel to butt. Now, if it feels okay for you, we'll reach the arms forward and squeeze the shoulder blades together with a little bit of pull. This move is great for posture. And it also helps you stretch your quads and hip flexors, which can get super tight and you can sit a lot. So we're just getting everything moving, the blood march. All right, let's move into a little twist side to side. It's gonna help mobilize our spine. So we take the feet about hip distance apart and you're just gonna twist side to side. You want to think about using your core, letting your feet leave the mat, and opening up through the hips and the back. Oh, this one feels so fabulous. I think this is my favorite move of the entire routine. And guess what? Stay with it. Standing up tall, breathing, and being proud of yourself.
Okay, guys. I think those were all of the exercises that we had in that session. 1 second. Yeah, so like you saw in the video itself, these are pretty simple to perform. We are working on all of the muscle groups that we have. We're taking a little bit of pause before we move to the next exercise, and that's what's important while you're trying to stay active as well as fit. Now moving on to understanding what you can do if you have a foot ulcer and how can physiotherapy help in such a condition. Because diabetes ulcer or diabetes foot ulcer is a pretty common complications that is seen in a lot of patients, and it is important to take it under consideration while trying to be active as well. We all know how a diabetic foot ulcer develops. What are the different causes of diabetes ulcer? The main reason, इसका main reason होता है कि आपकी जो nerves होती है वो excess blood glucose, जो glucose आपके blood में होता है उसकी वजह से damage हो जाती है, and mostly seen in patients who have had diabetes for a very long time, who are not able to control their diabetes. And since these nerves are getting damaged, it's mostly the nerves of your legs or of your feet that are getting damaged, and which is why it is called as the diabetic foot, because your foot is the one that is getting impacted. The different symptoms that a patient who has diabetic foot or has had nerve damage in the foot will experience tingling, a little bit of pain. This pain can be in the form of a burning pain or a stinging pain. It can be different for different people. Your feet become numb. Numbness is a major factor that a lot of patients come across. It's a major symptom that a lot of patients come across. They don't feel any sensations in their feet because their nerves have gotten damaged. Now, this is obviously due to the uncontrolled level of blood glucose that is present in your body. Now, what happens when your feet has lost sensation or you're not able to feel if there is any injury present? What ends up happening is that you end up developing a lot of small cuts, small bruises from walking, from the shoes if they're not fitting you properly. There is constant trauma or there is constant stress that your feet are undergoing, but you're not able to realize it. आपको समझ में ही नहीं आ रहा आपके पैर पे कोई चोट लगी है, कुछ किसी जूते के वजह से आपको शू बाइट हुआ है, या तो वहां पे कोई कट आ गया है. एंड देन वंस all of these cuts or bruises are going unnoticed over time due to the reduced blood circulation to your feet or to the different parts of your body because of diabetes. These cuts or these bruises are not healing properly, which leads to the development of ulcers. And this is all because of different factors that are coming together. जैसे कि आपके पैर पे बहुत ज्यादा स्ट्रेस हो रहा है, आपको sensations feel नहीं हो रही है, आपका blood circulation कम हो गया है, and उसकी वजह से ulcers form हो गए हैं. There are obviously different stages of foot ulceration, but we won't go through it. It just sort of demarcates what are the different stages that your cuts or your bruises are going through whenever it is developing that ulcer, or whenever it is getting worse than an ulcer. So that's something that I think we can skip for now. So for a diabetic patient who has a foot ulcer, what are the different precautions that they can take before starting any physiotherapy exercises or even starting any exercise at home? Is that wear shoes that are comfortable, that fit you properly. They're not too tight, because if they're too tight, then they can end up causing you shoe bites, which can ultimately, or if the factors are right, or if the factors are in place, it can develop into an ulcer. So try to wear shoes that are comfortable and fit you properly. When you're trying to do any exercise, if you are doing it at home or you're doing it outside, try to have handy a foot brace or a compression wrap. What these things are trying to do, a foot brace will give you more support. आपके पैर को थोड़ा और support आ जाता है, so that you're not unnecessarily damaging the structure of your feet. Compression wraps will help you increase the circulation. Since in diabetes हम जानते हैं कि blood circulation थोड़ा interrupt हो जाता है, a compression wrap will help you get that circulation going, so that even when you're exercising, when your body is demanding a lot more energy, a lot more blood is flowing, it will help you keep your feet a lot more comfortable, and it will prevent any kind of injuries from happening as well. अगर आपको टेंडेंसी है, अगर आप there are different parts of your feet, अगर आपके पैर में different parts है जो काफी easily damage होते हैं, या तो फिर वहां पे constant stress आ रहा है किसी footwear की वजह से, या तो फिर चलते समय, तो आप कोशिश कर सकते हैं कि आप अपने जूतों में shoe inserts डालें. ये shoe inserts वो unnecessary stress या तो फिर वो unnecessary trauma जो आपके पैर पे constantly हो रहा है वो prevent करेगा. And always, like I've always mentioned, try to do exercises that your doctor or your physiotherapist are recommending to you, so that because they are the ones who know your history and your strength, your flexibility, so they'll be the best to recommend higher level exercises. The ones that we saw were pretty small or pretty easy exercises that you can perform at home. But if there's anything additional that you require, then a physiotherapist or your doctor would be the best to recommend those to you. So, there are certain chota mota foot care exercises that will help you increase the circulation to your feet, as well as help you with the pain that you're experiencing because of the foot ulcer. And this will also act as a preventive measure from helping you prevent the development of an ulcer, because since you're improving the blood circulation to your feet, you're improving the mobility of your feet, it can sort of help you prevent the formation of an ulcer as well. So as we can see, these are pretty simple exercises. I can show them to you what you can do on a day-to-day basis, even while you're sitting down. आप बैठे हैं और टीवी देख रहे हो, आप ये एक्सरसाइज परफॉर्म कर सकते हो. Sit comfortably on a chair, sit comfortably on your sofa, wherever it is that you're sitting. Try to imagine this is your foot. Try to raise your foot upwards. Your toes, you can bend your toes downwards and just do this, so that they're also becoming a little bit mobile. They're also receiving a little bit more circulation. Once you're done, extending and bending your toes, raise your foot upwards again. Once you're done doing this with your feet, try to get back to normal level, try to get back to floor level, and then raise the heel of your foot upwards, and then try to do this as well, so that it's also working out. So try to raise your heel from behind. Once you get back to this position again, try to rotate it like this. Try to, suppose this is your foot raised up, try to rotate it in circular motion, so that the front part of your feet is also getting worked out. And then once your heel is up, try to do that similar circular motion, so that the heel is also working out. Now, suppose this was just focusing on the foot aspect itself. If you want to work out the entire leg, then you can perform it similarly as shown in the picture. Raise your leg up, raise your foot up, and then get the other leg up as well, raise the foot of that leg as well, and try to do this motion with both of the feet. And once you are done doing that, you can try and create an S feature with those legs, with those feet as well. Okay, guys, I think we've completed the webinar. We can move to quiz time. 1 second. So we don't have a poll this time. We'll just, I'll take you through the question and you can add the answers into the chat box itself. Now, the question that we have for you is, what are the key aspects you need to take care of while managing diabetic foot ulcer? A, wearing comfortable shoes. B, performing foot physiotherapy. C, using compression wraps. And D, all of the above. Guys, you can add all of your answers in the chat box since we don't have the poll up. Okay, let's look at the answers that everyone has given. So the answer was all of the above. You need to perform all of these in order to, manage your diabetic foot ulcer. I think now we have, Rutuja, do we have some time for Q&A? I'm so sorry, guys. I think, yeah, we did extend a little bit, but let's see.
Yes, we do have 10 minutes. We can extend for 10 minutes. Sure. So we have few questions. First of all, thank you so much, Dr. Sneha. I think it was a great discussion and a great update on diabetes, foot health, and what all do we need to do as diabetic, what are the precautions, what are the details we need to follow in our day-to-day routine. So there are a few questions. Let me just address them. Yes, so you had shared a video link with exercises. Many of our users are asking for that link. So don't worry, all of you, all our AccuCheck Wellthy members, we will share that through your health coaches, through your dashboard, through your Wellthy app. Okay, so you will get the link of that particular YouTube where these exercises are mentioned, and your health coach will share that with you. Having said that, please understand this is not a common routine for everyone. There will be a customized journey which will be planned by your coach for you. But for now, just to refer, yes, you can go through that link and you can at least start with some activities throughout your day. Okay. So, Harshal ji, good evening. Thank you so much for staying active in the session. So, Dr. Sneha, Harshal ji is asking, what time gangrene can occur and what are the symptoms?
Sure. So, Mr. Harshal, there isn't a specific time for something like gangrene to appear. However, before, talking about when it does appear, I would say that it is a very end stage complication. There are ways that you can prevent it, or there are ways that you don't get to it if you are properly taking care of your feet as well. So how it appears is essentially if you start noticing symptoms like tingling, numbness, any kind of cut or bruise that is on your feet that has not, healed after a long period of time. A cut or a bruise will usually heal within a week's time or maximum 2 weeks. If it has extended or if it has exceeded that period of time and your ulcers have not healed, then it is important that you get it checked with your doctor. If you keep on ignoring these symptoms or these ulcers, then it is likely that it will get infected. It is likely that the blood circulation will reduce further. The tissues on your feet that you keep on ignoring over time will, eventually die off, which can lead to gangrene. But that is a very end stage complication which can be easily prevented by keeping a check of how your feet are doing every day. When you're coming back from work, you're coming back from outdoors, from exercising, try to see that your feet are in proper condition. There are no unnecessary cuts or bruises that have happened. If they have happened, try to take proper care of it. If they're not healing, check with your doctor, get proper medications prescribed or proper interventions done so that you don't develop gangrene.
Great. Thank you so much, Dr. Sneha, for that. Hope Harshal ji that helps us. Uh, Shaktidhar Singh ji is here with us today. Good evening, Mr. Singh. Thank you so much for joining us today. He's asking the exercise video which you shared. What was it, totally indoor or outdoor, and what is the time duration that they should follow on a daily basis?
Sure. Thank you, Mr. Shaktidhar. So on a weekly basis, the minimum goal is to perform 150 minutes of exercise. We can break this down to 30 minutes per day, or it can be 50 minutes for 3 times a week as well, depending upon how your schedule is, how much you work in a day. So on a daily basis, if you're performing these exercise, it just has to be 30 minutes, 20 to 25 minutes will also do. The exercises that we showed you, yes, those were indoor, but if you are a more outdoorsy person, you can take up exercises like walking, jogging, even cycling. If that is something that you are fond of, you can take that up. Swimming is another exercise that you can perform. So these are some examples of moderate intensity outdoor exercises. If you are a very sporty person, you can, if you have badminton, if you have someone to play badminton with, you can do that as well. So those are some examples of the outdoor exercises that can be easily accessible or can be available to you.
Great. Thank you so much, Dr. Sneha. Harshal ji is again asking us if his fasting sugar is in the range of 130 to 140. Will it cause foot ulcers or gangrene or any kind of diabetes related foot infections?
So, Mr. Harshal, like I said, if your diabetes has been controlled for a very long period of time, if you're not taking care to keep it controlled or getting it back to normal range, if for a very long duration of time your blood glucose levels are very high, then there are chances that your blood vessels, your nerves will also get damaged. So if one day your blood sugar levels are in the range of 130 or 140, it is unlikely that it is going to cause any kind of damage, to your nerves or your blood vessels. But if that same thing continues for a very long period of time, then there are chances that you might develop diabetic neuropathy, which is the nerve damage caused by blood glucose, which can eventually cause something like gangrene. But like I mentioned, gangrene is a very end stage complication. It is unlikely that this will happen to you if you're taking proper care of your feet and controlling the blood glucose levels on a day-to-day basis.
Great. Thank you so much, Dr. Sneha. Hello, Sanjeev ji. Good evening. Thank you so much for staying tuned for the entire webinar for today's discussion. So, Sanjeev ji wants to ask Dr. Sneha, exercise should be done after how much time of having food, especially lunch and dinner?
So, Mr. Sanjeev, what we would recommend is that you try to perform these exercises before you've had any food. If you've had a little bit of snack just to give you that energy, that is completely fine. But once you've had your lunch or dinner, these are pretty heavy meals, and it becomes a little more difficult for a person to perform any kind of exercise after something like this. So in the morning, if you've had your little snack before you've had your breakfast, try to perform these exercises. Obviously, keep in check what your blood glucose levels are. If they're too low, try to have a little bit of carb intake before you jump into doing these exercises. Similarly, completely depends upon what your blood glucose levels are at the moment, but try to do these before you've had any heavy meals, because it's very difficult to perform any kind of exercise when you're doing this with a full stomach.
Absolutely. Thank you so much, Dr. Sneha, for easy explanation. Shambulal जी, good evening. कैसे हैं आप? Thank you so much पूरे सेशन में हमारे साथ बने रहने के लिए. शंभूलाल जी is asking a question, Dr. Sneha. एक्सरसाइज करने का सुबह का टाइम सही है या शाम का टाइम सही है? खाने के कितने समय बाद एक्सरसाइज करना उचित है?
आई थिंक इसका सेकंड पार्ट तो हमने आंसर कर दिया. इसका फर्स्ट पार्ट आई कैन गिव यू अ शॉर्ट एक्सप्लेनेशन. हम यूजुअली या तो सुबह के टाइम करते हैं या तो शाम के टाइम पे करते हैं, बट ब्लड ग्लूकोज लेवल्स जो होते हैं सुबह के शाम के टाइम में 4 से लेके 8 बजे तक देयर इज अ नेचुरल surge of hormones that is happening, and which increases your blood glucose levels. One second. Which increases your blood glucose levels. So even if you're performing it in the evening, आप सुबह कर रहे हैं या शाम को कर रहे हो, it's completely up to you. आपको जो टाइमिंग परफेक्ट लगता है, आपके पास सुबह टाइम हो या तो आपके पास शाम को टाइम हो. आप अगर शाम को परफॉर्म करने की कोशिश कर रहे हैं तो इसको मे बी आप 7 के बाद परफॉर्म करें, 8 तक के परफॉर्म करें, डिनर से थोड़ा पहले परफॉर्म करने की कोशिश करें. एंड सुबह के टाइम पे भी बिफोर आपके ब्रेकफास्ट के पहले 7 के आसपास. बट आप जो भी टाइम चूज करें, सुबह का टाइम हो या शाम का टाइम हो, आप ट्राई करें कि हर दिन आप सेम टाइम पे ही परफॉर्म करें, ताकि आपकी बॉडी को उतना हील होने का मौका मिले, आपकी बॉडी को उतना रिकवर करने का मौका मिले. तो आपके स्केड्यूल के बेसिस पर आपको जो टाइम सही लगे आप परफॉर्म करें, बट आप कंसिस्टेंटली उस टाइम को फॉलो करें.
Great. Thank you so much, Dr. Sneha. Two more questions and we will end today's discussion. So, Yadav ji, good evening. कैसे हैं आप? Thank you so much for connecting with us today. So, Yadav ji is asking, is it okay that I walk 3 to 4 kilometers daily? I do 100 sit-ups, 30 minutes of yoga, and 5 to 10 minutes of pranayam every day in the morning, and I'm 67 years old.
That's actually amazing, Mr. Yadav, that you are able to perform all of these exercises at your age. uh, it's completely fine if your body is used to it, and if this is the exercise schedule that you are comfortable with and you have gotten used to. अगर आपको कोई issues नहीं आ रहे हैं उसके वजह से, then please keep on continuing the all of the exercises जो आपने mention की है. These are pretty moderate intensity exercises that we have been recommending. अगर आपको कोई दिक्कत आती है, अगर आपको ऐसा लगता है कि आपकी बॉडी बराबर से रिकवर नहीं कर पा रही है, तो आप डॉक्टर से चेक कर सकते हैं. बट I don't see any issues happening at your age because of the exercises that you're performing. Please keep on doing those. If any issues do arise, do talk to your doctor.
Great. Thank you so much, Dr. Sneha. I hope this answers Yadav ji your question. Uh, Hello, Chakravarti ji. Good evening. Thank you so much for staying connected from the beginning till the end of the session. So, Chakravarti ji is sharing some information. Diabetic patients should prefer complete covered, comfortable sport shoes or comfortable open belt shoes or chappals. Which one do you recommend? It is mainly for walking type of exercise.
Okay. Okay. So the type of footwear is what Mr. Chakravarti is asking. So what we would recommend is get covered footwear, the kind of footwear that covers your entire feet, so that उसकी वजह से अगर आप जब भी walk पे जा रहे हो, रास्ते पर काफी पत्थर वगैरह होते हैं, काफी चीजें होती है जो आपके फुट को इंज्योर कर सकती है। विद इन दीज कवर्ड शूज, जो स्पोर्ट शूज होते हैं, इसमें आपका पूरा पैर कवर्ड रहता है. ट्राई टू मेक श्योर दैट it fits you properly. It's not too tight for the size of feet that you have. Try to avoid wearing open belt shoes or chappals when you're going for walk, because you don't know if what can be causing injury to your feet. Try to keep it covered with sports shoes itself. There are special footwear that are available for diabetic patients as well. If that is something that you would like to consider, you can speak to your doctor. They might recommend it to you as well.
Correct. Thank you so much, Dr. Sneha, for that. Chakravarti ji, I hope this answers your question. So, last question for the day, and Sanjeev ji wants to know about BPM during exercising. During exercising, the BPM increases. What is the normal BPM which is okay for a diabetic person?
Got it. So that's correct, Mr. Sanjeev. Your BPM does increase, and during exercise, and that is the aim of doing any kind of exercise, is to get your heart rate to increase so that you're sweating a little bit, your body is exerting a little bit. Your normal BPM in resting stage, or when you're not doing any exercise, needs to be less than 120 beats per minute. But try to keep whenever you're exercising or exerting yourself, try not to get it to a level where it is too much for your heart to handle, or when your blood pressure is also increasing. Try to keep it to about 150 to 180 beats per minute. Anything higher than that can lead to a lot more stress on your heart, and ultimately damage your blood vessels as well. So try to be within that range. Try to take small breaks between your exercises. That will control your beats, your heart rate, as well as give you the effects or the benefits of the exercises that you're performing.
Great. Wow, so much information related to diabetes, health, and exercise. Thank you so much, Dr. Sneha. I think it was a great discussion, not just for me and my team, but for all of our AccuCheck Wealthy family, to understand that why exercising is important, why exerting yourself every single day with some amount of heavy exercises is essential. What are the things which will help us keep our blood sugar and type 2 diabetes under control? It was a great session. Thank you so much. To all our AccuCheck Wealthy members, feel free to share the feedback with your coaches on today's session. With this, Dr. Sneha, we come to the end of today's session. Thank you so much for your association with us. Next week, for all our lovely AccuCheck Wealthy family, we are coming up with a new speaker, a lot of more information, and a lot of knowledge sharing. Yes, next week, next Saturday, something new coming up for all of you. Till then, take care of your health, eat healthy, and don't forget to update all your routine to your health coaches. Have a happy weekend. Thank you.